to Professor Krzysztof Tomasiewicz, who's the head of the Department in Clinic of Infectious Diseases and Hepatology at the Medical University of Lublin in Poland. He's holds a variety of different positions, including being head of the expert committee for both hepatitis C and hepatitis B, and works with EASL and a variety of other international organizations. And it's great to have you here. Thank you.
Thank you so much for the invitation. So looking back at the presentation, which were prior to mine, I have to say that we are in a completely different situation because first we start with a very low prevalence of Hep C. If I compare to Georgia, for example, then you have 7 or 6% population, we have 0.4 viremic patients. So when I'm looking at the target for WHO, target for elimination, the main target is the reduction. So when we start from the top, it's easier to reduce than when we start in the bottom. So that's first. The second, it will be not a story of success, because I want to show you that we have a lot of problems with the elimination, with achieving these targets. So I try to be very concise with my presentation, but I just want to show you what problems we have with this elimination. So first, that update, it's 2018, so it's not an update, but you know, when we want to eliminate, we have to know what kind of patient we may expect for this identification, because the main problem in Poland is identification of patients. We don't have too many patients who had been infected because of drug using or something like that. So we still have a dominance of medical devices or medical procedures related to infections, but it's less than it was, let's say, 10 years ago. The second, we still do not have the national plan for the virus elimination. So unfortunately, I'm showing you the numbers. This is more than 700 screening patients, screening people, but all this screening program was supported by industry. So we did it with the help, in this case, with the help of AbbVie. And now we have some more programs. We also are supported by other pharmaceutical companies. For example, now we have a program of the screening in psychiatric hospitals, psychiatric patients, because we expected the high prevalence. It's not as high as we expected, but we are not supported by the government. When you look at the percentage, you know, the diagnostic laboratory, we have an idea that the AbbVie had an idea to open screening procedures for everyone who is interested in screening. Just he has to go to their lab and say that he wants to be screened for Hep C, and they offer both anti-HCV and HCV RNA screening for these patients. But when we look at the other points of testing, for example, in the hospitals, it's 0.7. So we have some recommendations for screening that anti-HCV screening in Poland should be universal screening. So everyone should be screened for Hep C. However, if it's not possible, we have to focus on hospitals, on some private medical centers, in diagnostic labs, etc. And what is really important, we have to use rapid anti-HCV kits. Otherwise, we will be not able to screen those patients. Of course, we have an influence on COVID-19 pandemic. So if you look at the numbers in 2021 and 2020, it was much lower than before. 2022, we started to go up with the number of tests which were used. But if you compare these curves from 2020 and 2019, is a huge difference. However, this graph is very important because we can see that we have two peaks. The first one, which is very obvious for us because it's related to medical procedures. So all the patients who had been infected many years ago. However, there is also a peak in patients in the population between 35 and 40, which probably they could be also infected during medical procedures. However, it's a chance they could also use drugs, and etc. So we have two populations which should be screened very carefully. Of course, if you go further with the test, if you go more tests for patients, we have a bigger chances to find these patients. But these are the results of the testing in patients who had ALT more than 35, which for more tests is still a normal value. However, is upper limit of normal. So in these patients, you see we have 3% of the prevalence. If you compare with 0.4, it's quite important. I'm showing this graph because we have a program for 40 years old plus patients. They are tested for ALT and AST and some other biochemical and morphology. So it's for me it's a success because we have a lot of patients from this project, from this screening project for let's say this is the health checkup for these patients, and if they are found to have ALT more than 35, they are tested for Hep C. Unfortunately, when we look at the progress to WHO target, we still are not on track. So if you compare this map, the Europe map from 2019 and 2020, some countries succeeded and they changed their status. For Poland, we still are not on track. Why is that? Because we have no chances to achieve this target before 2030. So as you see here, for 90% diagnosed, for 80% treated, for 65% reduction in mortality and 80% reduction in incidence, we are about 2050 or even 2060. What happened? What is our success? We had struggled with the government to offer or to support all family doctors with free testing for anti-Hep C for all patients. And in June 2022, so 1 year ago, we were very happy because they approved the free testing for all family doctors. So they had a chance since July the 1st, 2022, to offer testing for everyone. However, if we calculated the number of tests which was done during this, this is not the project. This is a law. They could test the patients. They are paid with extra money for this testing. But you see, during first five months, they tested 15,000 patients, just 15,000 patients, which means they will test about 37,000 patients per year. This is nothing because we tested, so they maybe 50,000 per year, because we tested in this pharma-sponsored campaign more than 225,000 patients. And what is necessary for WHO target, we have to test 3 million people per year. So using these family doctors with this trend, we will not succeed. We will not achieve any success. What about people using drug? So this is a Swiss contribution project. Sorry for these Polish letters, but I have no chance to change it. But this is just to show you that the prevalence is more about 50% about these drug using patients, and for those who are injecting drugs, it's about 64%. So we have a huge population of drug users who are infected with Hep C, and they are not tested. This is another shame for us, because here we have Polish prisoners. This blue bar is a number of prisoners, and the brown bar is number of tests done for Hep C. And you see how many how many tests we do for these prisoners. We have also the law, which is they should be tested, but no one is interested in testing prisoners. I don't know why, because we offer them that we will diagnose these patients, we will do everything. We accepted non-invasive tests, not fibroscan, anything. APRI, FIB4, etc. is enough for us for our program, but they are still not tested. This is just a few % of prisoners who are tested for Hep C, and the prevalence, as you can see, is about 7–10% of those prisoners. So, and about half of them, they are identified for the first time. So they have no idea they are infected with Hep C. This is our recommendation from our Polish group of experts, which it was released at the end of 2022. So we focus on where these patients should be tested. They should be tested in primary health care settings, in hospital emergency departments. This is very important because so far in Poland, this is not obligatory testing patients in these emergency departments, and prisons, which is necessary to introduce for the testing system. So far, we have no national strategy, unfortunately. It is said that it is on preparation. It means that we gave the government the ready national strategy, and this is not accepted by government. So what I'm jealous about the previous presentations, you have political will. We don't. We have no political will. They are not interested in the elimination of Hep C because they do not consider Hep C as a problem, as a health problem. Maybe because this is just 140,000 patients, not 4 or 5–6 million. We have no reliable national epidemiologic data. What we have is unlimited access to free DAA. So we can give everyone treatment. This is not a problem. This is free of charge. Everyone can be treated. And I have to admit that 2015, we were probably the first country with the open access to everyone who is infected with Hep C. 2019, nothing changed. So a few words about refugees, because as you know, Poland is probably we have the highest number of refugees from Ukraine because of war. This is just a few numbers. We consider that it will be about a few millions from refugees from Ukraine. We have no time to go in details. The main population in these refugees, they are females aged 18–65. When we look, this is data from the August 2022, but it hasn't changed too much. They are very interested in working in Poland, which is good for us because they have insurance and they feel much better working in Poland. And for the question, do you intend to return to Ukraine? Just 9% said no. So they probably will be very eager to go to Ukraine back. They have an access to healthcare, and they know they have an healthcare in Poland. But when we ask them about barriers, so the information barrier is the main barrier for these refugees, and the most used government health facility and private health facility. So so far in 2022, in our program of treatment of Hep C, we treated 5,825 patients and just 57 patients from Ukraine. They have unrestricted access to medication, the same like in Romania. They have not to be insured, but the problem is that a lot of Ukrainians, they received Polish ID number, and they are not considered as Ukrainian for the project. So probably we treated much more patients from Ukraine, but there are still a lot of should be done. And for the future is means July 2023. We have a patients organization which is Star of Hope. They are really engaged in the process of screening, of treatment, to achieve this population, and they have some plans for this approaching month. So they want to give the stories of patients treated in Poland. They want to share the video. They involve bloggers from Ukraine. So they use these resources for having better access for Ukrainian refugees. So probably I expect during next month we will have much more patients from Ukraine. What is necessary to know that we don't use Polish media because Ukrainians do not watch Polish TV, and we don't want to arouse negative mood and stigmatization. I know we are in 21st century, but we still have to talk about stigmatization in Hep C, unfortunately, but this is the truth. Thank you so much.
Questions? Thank you. Oh, sorry.
Hi there. Thank you very much for your presentation. Marcelo Naveira from WHO Europe. A question regarding the political will. Do you see that there is an opening and opportunity to maybe engage hepatitis in a national cancer strategy? I know that the cancer strategy mentions somehow hepatitis C, hepatitis B, but perhaps that will be the way to go with NCDs. A lot of colleagues from University of Antwerp, Achieve, or Hepatitis Alliance, the CDA Foundation kept growing this message that perhaps hepatitis is losing the steam, and we need to engage somehow in the cancer train and collect some momentum for all the member states.
We thought about that. So we have a project for anti-cancer prophylaxis, and we wanted to Hep C and Hep B be introduced in this project. But you know, the government gave family doctors the tool, the access to free screening. So the problem is that family doctors, they are not interested in testing a lot of patients. So for the government, they click, they are okay because they gave the tool. But for us, the family doctors, they don't test patients.
Would be interesting to hear from Romania and some other situations, you know, how they got their family physicians interested in testing. Maybe that would be helpful. Do you, anything come to mind in that regard? Or, Moka, do you want to talk?
Well, thank you. Mojca Maticic from Slovenia. Thank you for this presentation, and I was really surprised. I thought that Poland is doing much better according to some other data that we got, but I'm so sorry about it. Have you tried with the micro-elimination in the groups that are already, that they do have their medical records, like, I don't know, HIV positives or some others? Because to start with that, this is the easiest way, I think, and then to engage others to go wider.
Thank you for this question. That's why I shown the routes of transmission in Poland. So for HIV patient, this is not a problem. All HIV patients are tested for Hep C, and maybe they are not eliminated with Hep C, but I have a feeling that we treat all patients with HIV positive. This is not a problem. We wanted to do microelimination in prisons. That's why I showed that we also convinced some people from responsible for prisons that they should be tested. But there is a gap between those who decide about having some projects and those who have to do these projects. That's the main problem. And other microeliminations, what can I say? We have a project for the microelimination hemophilics, but this is probably not a problem anymore for the elimination because, you know, they are tested for Hep C. So.
It's here. You're right, it's here.
Thank you. That was an excellent presentation. Thank you so much. We learned so much about Poland. Appreciate it.